So these days, I mean, we see our children, going through major stressors. I mean, every child, every generation has their stressors. But we see things are manifesting in more extreme ways, it seems, with the generation right now. So one thing that's overlooked that it's not really on the forefront of what we're paying attention to in terms of being a causative factor is infection, and infection causing neurological inflammation, autoinflammatory neurological inflammation. So it's a reality, and we know that something like strep, there is a condition called Pandas or Pans, that it's a pediatric autoimmune neuropsychiatric disorder that is due to strep infection. So an untreated strep that causes autoinflammatory reaction to the neurological tissue, bringing on personality change, tics, anxiety, aggression. So there's no question the society that we live in, the international arena, there's major stressors. But many times, we're seeing that the being so sensitive to these external factors is really due to an internal infection that is driving that inflammation. So, right, parents should be aware and pay attention that maybe it is something as simple as an infection. And then, it can go on for a number of years if it isn't treated. Certainly you want to take care of the infection by taking an antibiotic, taking care of the actual strep infection. And they may have had a little sore throat, they may have not. I mean, it doesn't always happen. It can be passing, you're like, oh, it wasn't. It's a little cold, a little virus. So you have to treat the infection to get rid of the organism, but then the autoinflammatory process is still there. So certainly if it's caught early, you see this personality change, aggression, anxiety, OCD, tics. You see that, the sooner you treat with an antibiotic, and you can do a blood test to check antibody levels and neurological inflammation. Right, the sooner obviously it's going to reverse. Somebody's had it for a year, couple of years, months, doing things, obviously treat the infection, and then doing things such as the methyl form of folic acid, 5-MTHF, something like our kids' comb that has different biochemicals in there to reduce inflammation and calm down the post-traumatic stress aggression state that the body can get into, reduce the neurological inflammation. So you want to treat the cause and then calm down that neuroinflammatory response. So just parents should be aware that this is a reality. Watch for it, you can test for it, and then you can search out doctors that know how to test for it and know how to treat it. And God willing, I've seen many times where a child returns to their normal state, their normal self, after being treated and getting the neural inflammation down. So parents should be aware, and God willing, we pay attention to our children and do what's right to help them.